Hello, my name is Don Tatalovich. I'm the owner of Cornerstone Dental Center and Same Day Crowns. Why is this exciting to us? So with Same Day Crowns, we have the opportunity to see you to repair a tooth that needs a crown and to have you visit us for the day and then leave having your permanent crown that same day, as the name implies. What is a same day crown and why is that different or important? So for a patient who needs a crown, traditionally you would have seen your dentist and they would have repaired the tooth and reshaped that to receive a crown or a cap on top of it. Then they would have taken an impression and sent that to a lab, and that would have taken a couple weeks to fabricate your crown. During that period of time, you would be wearing a temporary crown, and hopefully that wouldn't break or come off during that time. Then after that 2 weeks, you would receive your permanent crown. For a same day crown, after we determine that you need a crown on that tooth, we'll do the same process of repairing the tooth and preparing it to receive a crown. But then instead of taking that traditional goopy impression, we'll do a digital scan of the tooth. And then with our design software and our in-house mill, we'll actually be able to fabricate or customize your permanent crown that same day. So you'll leave with that crown on that same day you see us. Who might be a candidate to receive a same day crown or benefit from that? For a patient who has a tooth that needs to be repaired with a crown, generally a same day crown would work for any patient that needs a crown. And so that would be something that we would want to take a look at your tooth or teeth, evaluate that area and make sure that a crown is the right treatment modality for that. If that's the case, then we could get you scheduled and take care of that with a same day crown. So what does it look like to have a same day crown customized for you? With that same day crown appointment, once we've decided that that's the treatment that's appropriate, we would see you for that appointment and that tooth would be repaired. So we would need to remove broken filling or any sort of cavity that's in that tooth, and then we would replace that with filling material to replace lost tooth structure. After that, the tooth can be reshaped to receive a cap or crown on top of it. With that appointment, once that initial reshaping of the tooth is done, you'll kind of hang out here in the office and read a magazine or your phone, and then we'll do some lab work where we design that and then mill that, sinter it, and then we'll do our final try-in and cement that into place for you. With the same day crown process, what technology is needed for that? So one of the things that we've gotten good feedback from our patients on is the digital scanning process. So with that same day crown, we'll actually want to digitize your teeth, your mouth by scanning it. That'll allow us to design the crown and then fabricate that by milling it. And so with that custom crown design, that digital scan, patients are very happy that we don't have to use that goopy impression material in order to get an impression of your mouth. So that, and then the fact that we can, like I said, control each step of the way as we customize your final crown for you. As far as misconceptions with crowns and even fillings, we could say, with patients that have a new crown placed, we've had people surprised that maybe home care needs to be as good as for your natural teeth. We have to remember that tooth, the natural tooth, is still there. So we still have the tooth in place and a root there. And so that needs to be brushed and flossed and water picked just like you would a normal natural tooth. We also need to see you regularly to make sure that there's not any issue as far as decay or gum health problems so that we can keep everything healthy for you. So how do I know if I need a crown? That would be the first step. I think would be to give us a call. Come on in. We'll take a look at teeth and mouth for you. We want to make sure that everything is healthy. And if there is an issue that you're having, whether that be discomfort with a tooth or something's changed, sharp or jagged or uncomfortable, we can figure out what that is and we can figure out what the right treatment might be. And so that might include a crown, but really taking maybe a few x-rays and a few pictures for you depending on what you need and figuring out what the right treatment is for you.